Hi, I'm Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. I get a lot of questions about inflammation. What's good inflammation? What's bad inflammation? What do I do about it? How do we test for it? So let's just go through a few kind of a summary of the difference between acute and chronic inflammation. What are some lab markers, and then some basic concepts that we can do to help keep our inflammation in check. Because people realize that a certain amount of inflammation is good and normal. It's part of the body's normal immune and inflammatory response, which is absolutely accurate. If you get a cut, let's say you're cutting, carrots on a cutting board, and your finger gets in the wrong spot, and boom, you kind of slice one of your fingers, and it swells up, and it looks kind of gnarly and swollen, and it's painful. There's a really important response that's happening. Your body's kind of flooding it with inflammation, because a big part of that inflammation, that inflammatory cascade, are things that help to clot the cut so it doesn't keep bleeding. And then also certain immune factors like neutrophils, which is part of your white blood cells, and macrophages. Macro means big, phage means eater. They're big eaters. They're part of also your white blood cells that show up to an area of injury, because sometimes around a site of injury there can be some pathogens, some like bacteria that are hanging out in that area, and so the immune system rushes in to try and quench any pathogenic infection. And so it's a really key, very important response that the body has in the acute sense. And so that's all totally, or if you roll your ankle and your ankle swells up, the swelling is part of the natural splinting mechanism. It fires off some pain signals so that you don't put too much pressure on it, so the injury doesn't get worse. Again, it's pumping in certain nutrients, and it's helping to bring out, debris and damaged cells and particles. So that's all super good and very important response to have in the body. But that's different from chronic inflammation. Chronic inflammation it's like the foot is stuck on the gas pedal of the immune system and the inflammatory system. And we call this chronic immune activation. And this can lead to a whole host of things like autoimmunity, and even things like heart disease and certain types of cancer, and a lot of the, the chronic neurodegenerative diseases that we're all concerned about, like Alzheimer's and Parkinson's, have very much in their root inflammation. And so we look at inflammatory triggers in three different categories. There's diet, or certain foods, chemicals, and pathogens. And within the dietary part, first of all, there's certain foods that we know that are just more inflammatory than other foods. I'm sure you're familiar with them, things like, gluten-containing grains and dairy, and certain people, eggs and soy and corn. Those are probably the top, 5 or 6 different foods that are inflammatory. Some people can eat those foods no problem and digest them, and they don't cause inflammation. But as far as, coming up with a list of common inflammatory foods, those are some ones there. And then foods that, almost didn't make it to the list, but are just absolutely inflammatory chemicals, or things like trans fats. If you're reading the back of a label and it says hydrogenated soybean oil, that hydrogenation it's a ridiculous ingredient that should have never been manufactured, but it's very inflammatory in the system. Things like high fructose corn syrup also should have never been invented. It's just hideous stuff, extremely inflammatory. So diet has a big influence on your degree of inflammation. And then as far as chemicals go, there's a whole host of chemicals that in certain susceptible individuals can be very inflammatory. Some of them are things like phthalates, which is kind of a plasticizer. Another one called BPA, or bisphenol A. We've talked about a couple of these in past episodes. But in certain people, if their immune system loses tolerance to the presence of these chemicals, it can be very inflammatory. And then on the pathogen side, certain viruses or bacteria or parasites or molds could cause chronic immune activation, and that can kind of keep the foot on the gas pedal of your inflammatory system, and in some people that can manifest into chronic disease. So those are just a few things to kind of think about there. As far as lab tests go, there's some important markers that should be tested at least once a year. If you have some kind of underlying health condition, probably more frequently, like maybe once every 6 months. And so these inflammatory chemicals or these inflammatory markers are very accessible on standard blood work. And so one to think about is called HSCRP, high sensitivity C-reactive protein, and this is a general inflammation marker. It's sort of the accumulation of multiple inflammatory chemicals that build up in the system. These all get filtered through the liver, and then relative to the amount of those chemicals that are floating around, the body then spits out CRP, or the liver spits out CRP, and then we can easily measure that in the blood. So the higher a person's CRP, the more general inflammation they have in the system. That's one. Another one called homocysteine. Homocysteine, we could talk for an hour just about homocysteine, but it's a key inflammation marker that has to do with things like methylation. Methylation is a really key process, detox and kind of metabolic process that happens in the body. I won't go in too much detail here, but homocysteine is one. We talk a lot about, a lot of people talk about cholesterol and HDL and LDL. HDL being sort of the good cholesterol, LDL being the bad cholesterol. But we're forgetting something about LDL. LDL itself is not inherently bad. A certain amount of LDL is absolutely vital for normally functioning cells, but it's when the LDL becomes oxidized, then it becomes an inflammatory molecule, not good for your cardiovascular system. So there's a marker for that. We can measure OX-LDL, or oxidized LDL, very important marker to look at. Another one would be hemoglobin A1C, or HbA1c. HbA1c is a marker that's typically used for things like diabetes, or you're trying to measure a person's risk factor for diabetes or insulin resistance. And it's not just a marker for diabetes. It's very much an inflammatory marker. It has another name. It's called glycated serum protein. And this glycosylated glucose, or this glycosylated hemoglobin, is a very inflammatory molecule. It's a very damaging molecule, and it's a great little window into other proteins that might be glycosylated in the system. Glycosylation is basically a sugar molecule and a protein sticking together, and this is a very inflammatory molecule in the system. And so HbA1c is a very simple measurement to be able to evaluate a person's level of this type of inflammation. So those are just a few things from a blood work standpoint that if your doctor is not testing these things regularly, I would suggest that you ask for those specifically. And then from kind of a treatment or therapeutic standpoint, a really key thing to think about is the last thing that we talked about, which was the HbA1c and glucose. We know that glucose in excessive amounts is very inflammatory for the system. So a good place to start, just to help keep your general inflammation in check, is to keep your glucose down, keep your insulin down, and keep your refined carbohydrates down, which leads to that elevated glucose. So from kind of a therapeutic perspective, we've known for a long time that fasting, intermittent fasting, low carbohydrate diets, even the ketogenic diet, and even using certain ketone supplementation helps to decrease your glucose and raise your ketones. So from a dietary perspective, the more that we can keep our carbohydrates in check, we don't want to go, completely flatline the carbohydrates. They're really important to at a certain level, but after we exceed our body's ability to use those carbohydrates, which unfortunately our ability to use carbohydrates goes down as we get older. So particularly as we get older, we want to keep our carbohydrates in check, because the body kind of loses the efficiency of using those carbohydrates. And then that's when we can get into things like inflammation and insulin resistance. So have diet really as the centerpiece to help manage your degree of inflammation. So just a little bit of food for thought, and hope that was helpful. A little discussion about inflammation really being the key, the centerpiece to a lot of whole variety of chronic diseases. So hopefully that was helpful, and we'll talk to you next time. Until then, keep it real.